I'm Rebecca Seitz, and this is Right to Life. Please allow me to begin with an apology. It's been a minute since our last episode, and the reasons for that are twofold. One, I've been working hard to raise funds to keep this show on the air. We are not supported by any of the groups that are working for or against Amendment 4 in Florida. To take money from them could look like we're trying to get their messaging out, and that's just not what this show exists to do. We're here to provide information. That's it. What you do with that information is up to you. This show is mostly funded internally by the 1C Story Network and a handful of individuals who believe in getting information into voters' hands. Second, COVID hit my house. Hard. This strain is no joke, friend. I was down for a full week, and I'm still a bit of a coughing mess. Y'all take good care out there. But finally, we were able to scrape together enough support and recover from COVID to the point that I could sit down with Dr. Betsy Brothers. She's an OB-GYN here in Naples, and she had some startling facts to share. Things like,
women are more than twice as likely to die in states with severe abortion restrictions. Those states with the most restrictive laws have among the worst across 32 measures on women's health.
Can you believe that? Presumably the new laws restricting abortion were done in order to save lives, and yet the stats show that these laws are literally doubling maternal mortality. But Dr. Brothers had even more stats.
The United States has the highest maternal mortality of any high-income country, 22 per 100,000 births. In those states with restrictive abortion laws, 51 women die per every 100,000 live births.
There is so much more from my conversation with Dr. Brothers, and I'm honored to share it with you here on the 5th episode of Right to Life. Dr. Betsy Brothers, thank you so much for coming on the Right to Life show.
Well, thank you for inviting me.
And thank you for rescheduling with me while I got over COVID. Our regular listeners will probably hear that my voice does not quite sound like my voice right now. I'm not completely recovered, but I'm not contagious, so it's okay for us to be in the same room.
We're sitting about 20 feet away from each other, and
let's be as safe as we can. So if we could begin with just you sharing your background, your educational background, and your work background with the audience.
I'm happy to. I'm an OB-GYN, and I am from New Orleans, Louisiana. I trained at LSU. I did my undergraduate, go Tigers, at LSU, Baton Rouge, and then went to LSU Medical School. And from there, I completed my residency at Vanderbilt University. And from 1989 to 1993, was a resident there, raised my family there, and we were there for 13 years. Aww. And then moved down to Naples. I did have a private practice in Tennessee, and then came here in 2001 and started a private practice in obstetrics and gynecology.
Wow. And you're affiliated with which? Most people know we have 2 hospital groups here in Naples.
Correct. Collier, the NCH, there's a downtown campus and then the North Collier campus, and so I'm affiliated with that and do deliveries there. That does all of the women's services. And interestingly, now we are the only hospital in Collier County that does women's and children's services.
Oh, wow. I didn't know that.
I know.
Okay. All right. So let's just get down to brass tacks, because people who've listened to this show for a little while understand that my goal with the show is simply to get my hands on information. We're not here to tell people how to vote or how to think or any of that. I'm just trying to get at some information, and a lot of it is information I did not have in my background of growing up the way that I did. So one of the things I did not know was exactly what are the types of abortion that exist, and when are they used?
Okay. We use the word abortion in maybe a different way that people traditionally think of it. For example, a miscarriage to us can be a spontaneous abortion or an incomplete abortion when you have a partial miscarriage. So in our traditional view, we look at any any loss of a pregnancy as an abortion. So I don't know if anybody has that experience being a listener where people have referred to it in that way. But for the sake of this conversation, we'll assume that it is an elective termination of a pregnancy for whatever reason. So the two types are a medical termination of pregnancy, which is done with medication. The other is a surgical termination, which is done through a D&C. Those are each determined by how far along a pregnancy can be. If it's before 10 weeks, then you can have a safe medical termination. After that, then we do a surgical termination with a D&C.
So medical termination, that's like mifepristone, day after, is it morning after pill?
The morning after pill actually just prevents a pregnancy from happening. So the morning after pill is not an abortifact. It is just simply giving progesterone. There is never any implantation, or that's not considered an abortifact.
Whereas mifepristone actually causes an abortion.
So for the medical termination of a pregnancy, that's of a recognized pregnancy, then you have the cytotec and the mifepristone, correct?
Got it.
Misoprostol and mifepristone.
And that's the most common, well, prior to the laws changing, that was probably the most common type of abortion, right?
Not necessarily. No, that's actually was maybe 20%. Now is up to, I think, 56% is medical terminations.
Okay.
So it's really, really gained a lot of traction.
Okay. So it's the most common now.
Now it is, correct.
Got it. And then the second most, I guess, would be the D&C that you mentioned.
Correct, the D&Cs.
I understand. And how far along... Like, where's the cutoff of where you can have a D&C, or is there a cutoff?
Circumstances are everything. So over 95% of, prior to Roe v. Wade, when we have the most data, 95% of terminations of pregnancy were done before 13 weeks gestation, and only 1% was done in the late second trimester, early. So the vast majority are done before 13 weeks gestation. And a pregnancy is 40 weeks.
Really? Okay, sorry. Because, I mean, in the movement that I grew up in, we were told, I guess the messaging was that abortions were happening in the third trimester, that the majority of abortions were happening in this third trimester, and you're saying, no.
Absolutely not. Absolutely not.
That did you say 90%, 95%?
Correct.
Are happening before 13
weeks.
I want to pause here for a second so that this information has a chance to sink in. If you are like me, with the majority of your information coming from the pro-life movement, then this information is likely shocking. I remember graphics of babies being partially born and jammed in the neck with scissors. I remember being told that millions of late-term abortions were happening, so many that it sounded like the vast majority of abortions happened in the third trimester. But the statistics show that this is untrue. Dr. Brothers just set us straight. 95% of abortions happen before 13 weeks. 13 weeks. I voiced my next thought directly to Dr. Brothers, which is before a fetus can survive outside.
Oh, yeah. I mean, really we consider 24 weeks limits of viability. Now, between 22 and 24 weeks is when we're actually talking to patients who have premature ruptured membranes or are at risk for rapid delivery. We're offering them the option to consider interventions to save the pregnancy.
So let's talk about that for a second. We're getting a little bit ahead of where I wanted to be, but while we're on this topic, in the amendment that we're all going to be voting on, it's 2 sentences long. Let me break in again here and read the 2 sentences of the amendment to you. It's important that we know exactly what the amendment states. The 2 sentences are these. No law shall prohibit, penalize, delay, or restrict abortion before viability, or when necessary to protect the patient's health as determined by the patient's healthcare provider. This amendment does not change the legislature's constitutional authority to require notification to a parent or guardian before a minor has an abortion. So when Dr. Brothers said that phrase, fetal viability, I wanted to talk further about it. And one of the phrases that is in that first sentence that everyone's trying to wrap their minds around is fetal viability, that this would enshrine the right to abortion in the state constitution up to the point of fetal viability as determined by a medical professional, by you.
Correct.
And you're saying that that fetal viability window is typically 22 to 24
Correct.
weeks. And what do you look at to determine fetal viability? What does that mean?
Well, with advances in NICU care, the things that are looked at, is the baby's lungs mature enough? Are the baby's organs mature enough? Or is the gut mature enough? So our NICU physicians are amazing, and the science has been phenomenal in extending the life, the viability, bringing the needle lower and lower. For example, one of the Kennedy babies in the way back in the early 1960s, died of prematurity at about 34 weeks gestation.
Oh, my son was born at 34
and now,
weeks.
Right. Mm-hmm. Now, you may fact check me on some of these numbers, but prematurity, and that was 60 years ago or whatever. So prematurity now, you go from 34 weeks, and now we consider that equal to a term baby as far as morbidity and mortality. Now we're down to 22 weeks when their eyes may still be fused. Their skin is transparent. All those things that it is miraculous to see the viability, go from 24 to 22 weeks, but intact viability. Will this child ever get off the ventilator? Well, those are the things that we have to counsel parents on when we talk about viability at 22 weeks.
So this idea that I'm hearing out there, that if we were to pass this amendment, that what we are as a state in effect saying is that you can have an abortion up until the day of delivery, that's not true.
I don't know how that information ever got out.
Okay, because
that's incorrect. That's incorrect.
The amendment does not allow for abortion beyond the point of fetal viability. And fetal viability is around 22 to 24 weeks, as we've just heard Dr. Brothers say. I've seen some political messaging out there that, okay, well, let me just say it frankly. It's lying. They're lying about this. Let's not fall for lies coming from either side. Let's operate in truth, okay? The truth is that the amendment would allow for abortion up to fetal viability, and fetal viability is 22 to 24 weeks. Now let's get back to the conversation with Dr. Brothers. Because it's up until fetal viability, as
Correct.
determined by people like you, who have all of the training and the knowledge in this, professionals. Okay, so let me ask you, one of the things in my background that I just didn't know is that abortion is medically necessary in some cases. We were taught that it was always just elective to escape the effects of having willy-nilly sex out there as much as you wanted. That's what we were taught. So when is it medically necessary to have? We've heard from a couple of women on the show when it was medically necessary in their lives, but if you could give us an idea of how is abortion used as a medical tool for the life of the mother or the life of the fetus?
So the indications for a termination of a recognized pregnancy, we look at either baby or mother. And in the case of mother, often severe mental illness can be an indication. Severe psychosis, severe depression would be one indication for it. Cancer, for a patient who has cancer and finds herself in the midst of treatment. That could also be an indication. It can delay treatment if she's newly diagnosed with cancer during a pregnancy. Cardiac diseases, there are several cardiac abnormalities that women have that would cause complications, would be complicated by a pregnancy. Certain medications, certain exposures, toxic exposures, radiation exposures could also be it. We also look at failed contraception in high-risk conditions. So, for example, say a woman has a condition and it's contraindicated for her to become pregnant, and she has a failed contraception, would be another indication.
Because that contraception can affect the growth and development of the fetus?
Well, because it would make, this is someone who has done everything they can to prevent a pregnancy and has a medical condition that would preclude a safe pregnancy.
Got it. Did you catch all that? She just rattled off 8 different scenarios in which a woman wouldn't be able to carry a pregnancy to term without it costing her life, none of which are allowed as exceptions to Florida's current heartbeat law. I have to say, the more I've researched this, talking with doctors and attorneys, the more I wonder if the legislators really have an appreciable knowledge of all the varying ways that women experience pregnancy. It's different every single time. Our age, whether we have illnesses like cancer or heart disease at the time that we get pregnant, whether we're on other medications to treat mental illnesses, or if we were taking birth control, or we have a birth control device implanted, all of these things can affect the proper development of a fetus. All those things and more that Dr. Brothers just mentioned, we have to navigate through that every single time that stick turns pink. We have to take in all the variables and make decisions that are best for ourselves and our families.
And then, of course, we look at the fetal indications for termination, which could be incompatibility with life, or it could be severe cardiac disease, chromosome abnormalities, babies born with severe neurological diseases, meaning they have no brain. They have an open spinal cord. They have, where when the egg and the sperm get together and create a human being, sometimes it just doesn't happen right. And the chromosomes, they get extra chromosomes, too few chromosomes, and they can maybe survive to a certain point in pregnancy, but at that point, it would be too late to do an intervention, for example, leading the mother's life to be in danger. Or it could be a condition in which we know that the baby could be born, but that would die immediately after birth. And so those conditions would be an option for a mother. We'd like to offer her that option to not continue a pregnancy.
So when I hear about these, I was talking with a woman yesterday, and she said, when we talk about banning abortion, we're not talking about any of those instances because those are incredibly rare. Are they rare? Everything you just rattled off, do you see this
Well,
in your
my
practice?
world, that's what we see. And so as an obstetrician gynecologist, those are the conditions that we see. It is not I do have patients that find themselves pregnant for, and were not intended to be pregnant and may choose to go through a termination. But the ones that I see are those very conditions.
And you have a full practice where you're seeing patients all day, every day?
Every day.
So this isn't a couple women a year?
Correct.
Even in your practice?
Even in my practice.
So what does that look like now when you have patients that are coming to you and medically they're presenting as needing to have this option, but in this state they don't? What happens now?
Well, so there are a couple of options that, one, we can refer them out of state. And that's what's been happening primarily is they go to our maternal fetal specialist for confirmation, just to confirm what we're diagnosing, and then they are offered to go out of state.
So I know that the current law says, well, if you can get 2 physicians to write a letter saying that your life is in danger, then you can have an abortion. Realistically, just as a physician, does that happen?
So there's a lot of issues, and it's an excellent question, and we're just now seeing some of the effects, and they're being written about in the literature about what is happening to patients in states that have very restrictive laws. So a lot of our data is fresh because this hasn't been around for a long time, but so we're collecting data from Oklahoma, Mississippi, Texas, Arkansas, Louisiana, a little bit from Florida now, because this hasn't been as long as it has been in those states. A lot of the physicians and hospitals and emergency rooms are unprepared to take care of patients. So their first reaction is to deny them access to care. So because they're afraid, because of the draconian laws, because of imprisoning physicians, they're just afraid to take care of them. And so when women come to these clinics or these physicians or these emergency rooms, even with medical problems, the physicians are so afraid that they're going to be put in jail or charged with civil crimes that they are referring these patients to other states. So it's led to a poor quality of care for our pregnant patients and fear on the part of our medical community to take care of them.
Dr. Brothers' answer here reminded me of what attorney James Chillimi, you'll remember him from episode 2, of what he said. He told us that the law would likely make doctors and hospitals withhold care rather than run the risk of breaking the heartbeat law, because if they do break the law, they not only are subject to fines, but also a felony conviction and 5 years in prison. And now we have Dr. Brothers, a physician operating in Florida under the heartbeat law, telling us that withholding of care is exactly what is happening. I'm just letting that sink in for a second, because when I hear about that, I'm a pro-life person, which in my world, the definition of pro-life is that you nurture and care for life. That is what I mean when I say I'm pro-life. And I have to believe that the motivation for passing this law from a lot of the people who are involved in it was also to nurture and care for life. But the more that I find out on the ground from attorneys and from physicians, it's actually putting life at risk.
There's a lot of data from the CDC and other organizations that collect information on abortion, access to abortion, the numbers of abortion throughout the country. And what we've actually seen since 2020 is an uptick of abortions over the past 4 years. We have, I think, an extra 100,000 abortions that are recorded for the United States since this change in the law.
Really?
Correct. Not only have we increased the number of abortions, we have also increased the number of women who have died from complications of illegal abortions and limited access to care. So not only has it not been life-saving, it has been contrary to that. And this is accessible data.
Wow. Okay, so sorry, it's just a lot to wrap my mind around, because I don't quite understand how we got here legally from a motivation of let's take care of life. And we we literally are now under a law that is not only not caring for life, as you say, but is also ending lives and harming lives. I questioned Dr. Brothers further about this because it just boggles my mind. I do believe that most of the people who worked on the heartbeat law did so from a place of wanting to protect and nurture life. And so to hear that it is doing the exact opposite requires all of us who are well-intentioned to pause, to try to figure out what's going on. I mean, we're actually causing more abortions, more moms to die. That's what the data is showing. As we talked it out, I went back to that thing we're taught in the pro-life movement, that abortion is mainly used by people who want to have a lot of sex and not face the consequences. I asked Dr. Brothers about that. So why don't they just not have sex? That's always the question that gets asked whenever I'm whenever I talk with people about contraception.
And all I can say is we are human beings.
We are that.
And interestingly, the teenage portion of abortions is not significantly high. It's often married women. It's often people who already have a child. It is often married couples. It is often people who are disadvantaged socially, financially, economically, well, same thing, and education-wise. And often women who don't necessarily have the control over their bodies that we think that we should all have. Mm-hmm. For example, women who are in manipulative relationships, who are in power struggle relationships, who are sexually abused, assaulted, even in a marriage.
And we don't have that. As a physician, if you have a patient come in and they're pregnant as a result of rape, can you offer them an abortion? It
has to be, if it's after 6 weeks, they have to have proof. They have got to have gone through the legal system. They've got to have documentation that they were assaulted, raped, incest. So it can't be someone who, a college student, for example, who was maybe date raped, or a teenager who was assaulted or raped. Or it can't be someone who just is in tears in your office with a positive pregnancy test, who is afraid to tell mom, who was ashamed, who was fearful of those things. It has to be somebody who exposes themselves to the legal system and all of the ramifications that means for someone who has been victimized.
We went over this too with Attorney Chalimi in episode 2, but to clarify here, the current law does allow for abortion in the case of rape or incest, but only if the patient produces the police report from where she reported the crime. I just want to speak to you for a second as a sexual assault survivor. In that capacity, I want to say this is an awful precedent to set. Most of us women know that reporting the rape almost never ends in the rapist being held accountable in the court system. According to the Rape, Abuse, and Incest National Network, for every 1,000 rapes, only 7 result in a felony conviction, and only 6 in incarceration. So to force a rape victim to subject herself to a system that most likely, will not get her justice, to make that the requirement for her to be able to terminate the pregnancy caused by her rapist, I personally think is horrific. And it could only have been made law by someone who has never personally encountered the experience of sexual assault. But let's get back to my conversation with Dr. Brothers. So as a physician, how did you find out about this law being passed and that you could face 5 years in prison if you performed an abortion?
Well, it was a big part of our dialogue in the world of obstetrics. So when Roe v. Wade was first overturned, that was, a lot of states immediately went into that ban, and we were hopeful that the 15-week ban would be all there would be, because as we just discussed, 95% of terminations of pregnancy are done before that, and that's generally we can see a lot of the anomalies or complications of pregnancy or take care of women with medical problems before that. But the 6-week ban, that doesn't allow us to support our patients with these complications.
Mm-hmm, mm-hmm. So you're saying that you would be able to give better care to women if we did not have this law in place right now.
Correct.
But that you feel like you would probably be able to give the kind of care that you needed if it was a 15-week or a 22-week or a whatever.
Well, the circumstances when an advanced gestation requires a termination is often because the significant anomalies or the complications haven't shown up. I mean, we don't do full anatomy ultrasounds on some women until they're 20 weeks pregnant or 18 weeks pregnant. So there are cases where horrible abnormalities are found, and a family may choose, historically that family could choose to complete the pregnancy early, do a termination of pregnancy, but now are forced to continue that pregnancy through the duration under the current law.
So going back to the idea of fetal viability, at 22, 23, 24 weeks, wherever that fetal viability line is, you're telling me that if there is something wrong with this pregnancy, it's been detected most of the time by the point of fetal viability.
Oh, absolutely, yes. Most of the time, correct.
Okay. So if indeed, in the amendment that everybody has to vote for, the cutoff is fetal viability.
Correct.
It still would not allow for abortion after fetal viability.
Correct.
And fetal viability is determined by by a physician.
Correct.
Or the actual words are by the patient's healthcare provider, which is defined in Florida law. That is, those words are, I've looked that up and we'll talk about that on another episode. The term patient's healthcare provider is a very clearly defined term in Florida law. Okay. So that's not just anybody that calls themselves a healthcare provider in the state. And so you as a physician, you are trained in and know how to determine fetal viability and have that conversation with the patient.
We are trained for the gestational age.
Okay.
And so to assign a due date. Mm-hmm. So as far as the viability goes, as that is determined by between 22 and 24 weeks, we can generally define that period of time. The sooner we can see a patient, the better, of course.
So talk to me about the impact of this law on the practice, the practice of OB-GYN medicine in this state. What is that looking like for those of us who need access to your services at some point? Because I cannot fathom being a physician in OB-GYN and potentially exposing myself to 5 years in prison and a felony conviction.
Well, the residency programs in those states that do obstetrics and gynecology are having less success in filling their spots. There's more of a reluctance of physicians, of medical students, and newly trained doctors to do their training in a state that highly restricts access to abortion. We're also finding that physicians are coming out now are not as well trained in those procedures that are often part of a normal GYN practice, so that they're not able to handle those at-risk patients, not just for abortions, but for normal DNCs and those types of procedures. The other thing that we're doing certainly is the limited access of medication. So certain medications that can be considered abortifacs, the Cytotec and the
Mifepristone?
Misoprostol. So misoprostol is a medication that we use for a lot of indications, and we're actually having difficulty getting that from pharmacies. So there is some really intrusion into the doctor-patient relationship, everything from pharmacies and insurance companies as well.
So you're saying we're going to have a shortage of doctors to even see us through healthy pregnancies because the doctors aren't coming to these states to practice.
That is a possibility, and in addition, they won't be as well trained.
Because that's what we need, is even less training to take care of women in medicine. That's absolutely what we need.
Correct.
I learned the other day that so much of the medicine that we have, even down to ibuprofen and Tylenol, that our dosages have nothing to do with women. They're based on the size of the average male, that our dosing of, again, Tylenol and ibuprofen and things like that, we just weren't considered.
Well, the interesting part of these studies is they thought that women's bodies were too variable. We have periods and we have menopause, and so with that, it was just much easier to study men, whether it has to do with heart attacks, with the symptoms of cardiovascular disease in women, and especially pregnant women. And so, we clearly don't do studies on pregnant women, but to the degree that we even withhold care from pregnant women, it's sometimes hard to get your teeth cleaned when you're pregnant. Mm-hmm. Because of our concerns about,
I experienced that, yes.
Of taking care of pregnant women.
That's great. So in the reality that we were already living in, that you just described, it's getting even worse because now there's even less training.
Right, and there's more fear. There's more fear in the medical world to treat pregnant women, especially in emergency settings.
And the fear is because of liability?
Well, liability and jail time. So if there's a patient, for example, even though ectopic pregnancy is one of the indications for intervention, and an ectopic pregnancy is a pregnancy outside the uterus. So there are emergency rooms that are afraid to take care of these patients because they're not aware of the laws and they're just afraid. And so even though the law does protect ectopic pregnancy patients, physicians are still afraid. The PA that you see in the emergency room may not be aware of the law, and so turns you away.
So you said that the law allows for ectopic pregnancy. You're talking about the emergency orders that were handed down, because the law itself
Correct.
Does not, but those emergency
Correct.
orders that came
Correct.
down, I think it was May 1st or May 2nd.
Correct.
Well, let me ask you about those for a second, because I've been wondering, Normally, when emergency orders come down from the health department in Florida, they're only good for 30 days. And of course, those orders came down May 1st. And as I'm speaking to you, it's the end of August, which would indicate that those emergency orders have expired. But my hope is that they haven't somehow magically expired in due course this time, and we're still operating under them.
We are still operating under them. I have not been made aware that they have been revoked.
That was my question. Has there been any sort of indication to you as a physician that we're not still operating underneath the emergency orders?
Correct. We are still operating under those.
Okay, at least that is good to know.
That is good. That was a area of a lot of confusion in many states, and really put women's health and lives at risk.
Mm-hmm. So let me finish up here and ask you to paint your blue sky moment. As a physician, do you think that there needs to be regulation of abortion to provide care and to take care of women and their pregnancies? Do we even need to be regulating this by law?
Absolutely. I think there are, for the safety of the mother, for general societal concerns, and for the protection of a baby that is a viable age. So absolutely, I do think there needs to be oversight to make sure that we do protect our babies.
Is that oversight present in the amendment that we're all voting on?
Amendment 4 does protect a viable baby, correct?
Got it. Thank you very much for coming on the show, Dr.
Well, thank
Brothers.
you. Thank you.
When I was preparing to interview Dr. Brothers, I spoke with some colleagues to learn the questions that they would want to ask a physician about the heartbeat law. And more often than not, I not only received questions, but also astonishment that a physician was willing to come onto this program. The fear that Dr. Brothers mentioned is rampant among the medical community in Florida. Most are keeping their heads down, hoping not to run afoul of the political winds that brought us here. I believe her to be very courageous in her willingness to talk with us today. As I shared with her, I told her how Emily and Samantha from our previous episodes, how they ended their conversations with me. She smiled, and she said,
"My name is Betsy Brothers, and my patients have a right to life."
There's one more thing I'd like to share with you before we wrap up today. You might have heard that Governor DeSantis has declared October 6th as Protect Life Sunday here in Florida. On that day, pastors are expected to preach on the topic of abortion, with an eye toward having congregants vote no on Amendment 4. The phrase right to life is going to be heard from pulpits across the state on that Sunday, and probably all the Sundays between now and November 5th. But as I continue to learn more and more about abortion, a truth is hammered home to me again and again. When we say right to life, we really need to think about everyone who has a right to life. And we don't. Not in the pro-life community. In that community, the phrase only applies to the fetus. But that's not right, because there's a woman's life at stake, too. So to balance out the conversation, we've created t-shirts that ask, does a woman have a right to life? On the back of the shirt is that Bible verse from Proverbs that I love, the one that tells us to chase wisdom and get understanding, because that's what we're doing here together. That's what congregations need to do on Sunday, October 6th as well. They need to follow the biblical directive to chase wisdom and get understanding. So I'm encouraging you to get a t-shirt and wear it to a church service on Sunday, October 6th. You can see the shirts and get yours on the show's website. It's righttolifestories.com. The company that's making these shirts is a Black woman-owned company based in Jacksonville, and she has graciously agreed to provide a portion of the sales back toward production of this show. So please head over to righttolifestories.com, get your shirt, and wear it to church on Sunday, October 6th. Let's help make sure that the woman that God created is not forgotten in our right to life rhetoric.
You've been listening to Right to Life on the 1C Story Network. If you have a story to share or would like to learn more, please visit righttolifestories.com. This show is brought to you by the generous support of people who value life. To contribute, visit righttolifestories.com and click on the GoFundMe icon or get in touch.
The 1C Story Network, for the love of stories.